conversations like this to help people understand what's in place already, what kind of benefits they may already have for themselves and their families, and what's likely to come are just so critically important.
7 different health insurance agents all denied me because of a pre-existing condition. I can't tell you enough what this act means to me. In 2014, there will be no discrimination against pre-existing conditions.
The healthcare system was particularly broken for women in this country. We had jobs where we were more likely to be uninsured or underinsured.
I fall in the donut hole with the Affordable Care. I at least now can afford my medication.
About $95 million is now in the pockets of Ohio seniors thanks to the beginning of the closure of the donut hole. That's a lot of real money.
I'm just so excited to be able to see women walk through our center doors, knowing that they don't have to fear denials or delays or gaps in service needs. They can start taking care and focusing on themselves and getting the care that they deserve.
You should know that you and your family have reliable, affordable health care.
Our son Stephen was diagnosed with stage 4 osteosarcoma. First they had to shrink the tumor with chemotherapy, and then of course they had to do the surgery because that is the only way to treat osteosarcoma, is to remove the tumor. And our son at that time was a college student, but of course had to drop out to go through this treatment. And at that moment in time, as my son was healing, we were being asked, is your son going to be a full-time student come fall? Fortunately, with the change in the law, our son was able to be a part-time student.
Conversations from your lens as a nurse, as a doctor, as a health worker, as the mom of somebody who's done that, I mean, are just the most powerful things in the world, and pushing back against the misinformation.
I see patients day in and day out where this law will really and actually change their lives.
For her to be out going through the country and, speaking on behalf of patients, speaking on behalf of those who need health care, that's a very good sign that she gets it.
Well, I love to be in these kind of conversations because I think it's what the health care bill means. It's not the pages in the law or the kind of work done in the inside the beltway. It's really what's happening to people's lives, how it makes a difference.